Right. Hi, I'm Tony, and this is an explanation of what I'm trying to achieve and how I can help you, and how we can help one another, and how we can help this pretty awful state we've got with dentistry and the health service. So I really like peer review, but we'll come on to that. And anything that I find, if you want to know more detail, then go to my website and type in whatever you want to know. So if you type in DHS, that's about Dental Health Service. There are a lot of references. There are 10 about 5 minute long videos explain how we could improve the health service, obviously mainly related to teeth. But the main thing for you is, I realise that we're all at different stages, but you'd want to make money. That's what it's about. But we can do both. We can make money and help one another. So this is to help people in care homes. So yeah, I'm getting near that age, but my dad was, and that was sort of the impetus to do this about 8 years ago. So, but dental nurses should be able to go into, well, you can go into care homes and scan the mouth, and we can do asynchronous checkups, right? You can also take X-rays. There's lots of things you can do. You can apply silver diamine fluoride, and you can also scan dentures, and you can scan the mouth. There's so much we could do. It's just our hierarchy is rubbish at letting us get through. All they do is actually punish you for the slightest thing of being a day late doing your CPD. So you can get plenty of CPD that'll be of value. So this chap, I really like, and I made this video. This is my third attempt because I put his video in it, and there's a section just 3.5 minutes in that you want to listen to, but the whole thing's brilliant. And as a TED talk, it's under 20 minutes, because after 20 minutes, that's as much interest that anyone can have. So look up on YouTube, Ken Robinson. It's probably the most downloaded video. You've probably seen it, I hope so. Oh yeah, I thought I'd taken it out. Anyway, and the other thing about learning is this. I listen to a lot of different audio books because I spend about 10 hours sitting in a car some weekends, going to my parents, or going to see my mother. And this is from a book on innovation. I couldn't remember where I'd heard it, but basically, I went on to ChatGPT, and yeah, so Wikipedia is a great resource, and ChatGPT is obviously pretty good, and it talks about how these people, these black Marines, were set a task to fail, basically. And this is back in World War II, and there was segregation. So it's a brilliant story, but the outcomes of it are applied to any form of learning that you do, is you have to have feedback and you have to encourage one another, and we will make some mistakes, but we should learn from our mistakes collectively, especially when it comes to dealing with the body. But on the computer, I've made loads of mistakes already with this, and no one's got hurt. So these are some of the books. So I think it was Matt Ridley, and then I found out it probably wasn't. It was Matthew Syed. But these people have ideas on how we can improve health, how we can improve society. And you can see these are my audiobooks, and I think I got about 50 of them. But I think it's from Rebel Ideas. And what it is it's not quite the same. But with computers, the way that computers learn everyone's heard the thing of move fast and break things, which is social media. Well, what we can do is we can work in an agile manner. So I set this up. So this website, Denflix, I set up again during COVID for FDs, saying how we could use my videos that are all on Denflix, all with the text that you can copy, use your voice and upload them. And it's just how we can do that. But it'd be better if you could it'd be far easier for you to upload them to an app. But it's really expensive and takes time to build an app. But I can do that with your help. And then it'll only take you about 15 minutes to register with your own services on it. So that's how you would probably, inform your patients and give them some advice on what they need, also more likely what they want, and yeah, so you'll earn more money. And within the video, within the app, it'll also have some health advice that we can all put in, that we can all improve iteratively, as they do with all businesses. It should be an iterative process. And so I've asked the GDC about this. So there are about 10 questions I asked the GDC. So again, you can just pause that and see what I'd say. But basically, it says whilst there is a course that you can do to do the scanning, to do the oral health education, all these different things, you don't need to go on the course because it's not a registrable course. You just need to have some example that you've done it, and reasonably, you're not a specialist in it, but you can do it. And so I've been reading around all this kind of stuff, and basically these are all business things. So the white one's Steve Jobs, and if you wanted to set up your own practice, there's a way we can do that. And because these corporates about making money for their shareholders, and they just want to screw the public for as much money, and probably screw you as much money as they can to keep their profits high. It's a terrible way to work. Fast Secures, that's really interesting. It's a guy that set up, he nearly died. He had a stack of money. He doesn't tell you that he'd been to prison, but anyway, that's how you get money. Yeah, and he employs the young doctors, and it was mainly doctors because, yeah, that's his bag. But how he employs young top doctors before they get corrupted by a hierarchy. The Lean Startup, that's I showed you a little picture of what that basically about is being agile. And these other people at the bottom have all made money. But the way of money, by having a bottom-up approach to the business, very fluid, and they just trust the people. They give them the tools, and that's how everybody benefits. And yeah, so this is the course that you can do. At the time I asked about it, the 7 places that were doing it, only one was doing it online, and I don't think many people went on it, partly because you can imagine there's 60,000 of you, dental nurses, and with 7 sites throughout the UK, you can often end up travelling a long way. You can't, talking to some of the people who run these courses, they say that dentists won't release them. And all these things, we can do them online. But you probably need to practice on one another a little bit, like when I was a student, we used to give each other injections. We didn't take, I used to do each fillings and root fillings. Yeah, we didn't just take out teeth unless they needed to. And these are the things you can do. So on this apprenticeship, it does, you do intraoral plaque scores. Well, that you can definitely do that online. Impression taking is a little bit more difficult, but not with scanning. And the scanning now, you don't need to take an impression. It's not quite there, I don't think, but by the time you finish the course, it will be. And then applying fluoride, well, that's, you can apply fluoride on yourself, or rather on your friends, and if you buddy up, as I will say later, and then you can video yourselves doing it, and then that is the evidence that you've done it. You can keep a record on video, and if anybody asks, well, you've done the course. So this, as I say, it should be under 20 minutes, and I think I'd start the courses saying, listen, watch a video at home or two, and then get together and practice on one another, see what you agree with, what you don't agree with, and we'll all learn. And then taking photos and intraoral pictures, then obviously that's a huge help if we go to do asynchronous checkups. And moreover, that you can also take radiographs, right? So that's not actually down there, but you can take radiographs under supervision. Well, that's a nonsense. I mean, the amount of radiation, all you need is a disclaimer from the public saying, I'm happy to have 2 x-rays taken. Then we can run all these things through AI and give a good assessment. And this is all be through this website that I'm trying to get all my resources together on the one website. And the website will be fine. But, and obviously you can see it on your mobile phone as well. In fact, it's better on the mobile phone. But you can't customize the website. You could customize an app, and the same applies to a user, your patients. They could personalize it. They can personalize an app. They can't personalize the website. And on it, I've got there's a site there for carers, and lots of my patients ended up being carers at home. You never saw the people who were caring, but there's advice there, and there's about 6 sections. They've got videos of about 2 to 3 minutes showing a carer how they can just look after their clients or residents a little bit better. But the person that's made it, well, she, been doing this a while, and she's brilliant at it. And she does these online courses for carers. And so I'll get help from her on how she does it. So this lady here, Fiona, I met her when I was in the States earlier this year at Teledentistry, a mobile dentistry conference. And she's set up her own mobile service in Scotland, and she's keen to show everybody how they can do it themselves. So she set up a business. She has the hurdles, she knows the hurdles and the hoops you have to go through. And so together we'll be able to show you how you can set up your own business. And I'm pretty sure you could do that as a dental nurse as well. And as a group of you, you could set up your own mobile unit going round. The government want children to be seen at schools, and they should also be doing something similar for care homes. This is a resource for me then, so if you want to know a bit about me, I haven't really added much to this website that I made during COVID, but it's, you can look at my dental history. Someone ought to look at it. And it probably is why I'm banging on about this kind of stuff, because, I was interested in prevention as a dentist myself, and we could make this website. Dentistry's Gone Wild is a podcast. They're going to do it again, and obviously it's from the States. And that's how I heard about the Teledentistry, a Mobile Dentistry Alliance, and ended up going there and doing a talk on prevention. So that's my email address. And what I would say, when it said peer review at the top, peer review is the best way of learning. I set up a peer review group with a few others, it must be about 15 years ago. I'm going to it in a fortnight's time, I think. Anyway, yes, I know I'm going. I'm just not quite sure what it's on. But it's a great way to learn. And to run any of these courses, I think you can do things at home, but you need to meet up and discuss it. And that would be your evidence. So, finally, it'd be something like this that we could make. So it'd be a dental health service. And I just need there's a picture of me. So I'd have a picture of you. So I just need some people to engage with it. Clearly, I need some funding. So I hope some of you will do that. If you go into the Dental Health Service website now and it says work with us, there are details there. But ideally, I want to do some webinars with some nurses, and I'd want you to be in pairs, to work in pairs. So again, use the same email to get in touch. And let's see if we can help one another, and I can build a course that will, give you some ideas on how you can improve oral hygiene and oral hygiene instruction through teledentistry. Well, clearly, you do that on the phone to one another. You don't have to be in the same room. And then when it comes to disclosing, that would be practice on one another. Obviously, you do it yourself. But when it comes to cleaning the mouth, it's say for a care home, then you could practice on one another. And the 3D scanning, well, I did that myself. You don't need a dental scanner. I've got a scanner I bought myself and had help from UE 2 years ago. So you could just use a basic home scanner. It just takes about 10 times as long to use the scanner. So there are lots of things that we can do. So please get in touch, and let's see if we can help one another, and let's see if we can actually improve the NHS, even if we don't work in it, because people with a healthy mouth, well, their general health's better. We know that.